colleague. Welcome to Changhua, Taiwan for the ALA International Literacy Conference. My name is Charles.
Good morning. My name is Tu. We'd like to express our gratitude for your presence here.
Ladies and gentlemen, a special cultural performance that we'd like to send you now. Let's welcome the arrival of the Lugang Junior High School student.
친구치곤 예쁜 여사치는 개뿔 걔한테 지금 너를 뺏긴 거니 눈을 뚝 던져 I'm falling MIG65 I'm rolling 이 두 글자를 지워야겠지 우리 너무 미워도 I should let it go 두 번 다시 널 보고 싶지 않아 XO 반쪽 같은 소리 하지마 내 반쪽 이제 내 거야 나쁜 년이라고 하지마 나쁜 건 너를 그려야 XO XO 사탕 발린 말투 달콤했던 만큼 아프니까 제발 don't speak yeah. 아프니까 청춘 바람만큼 젊음 거울 속에 난 still pretty yeah. Oh no 찢었어 너의 photo 지웠어 너의 번호 bitch 나는 solo plenty fish up in the sea but they don't swim like me you know it keep on rolling if you miss it accent kisses exit noses for ya 미워도 I should let it go 두 번 다시 널 보고 싶지 않아 XO 반쪽 같은 소리 하지마 내 반쪽 이제 내 거야 나쁜 년이라고 하지마 나쁜 건 너를 그려야 XO XO 반쪽을 줬던 내가 안타까워 Had enough 다시 줘도 원하지도 않아 Just because 반쪽 같은 소리 하지마 내 반쪽 이제 내 거야 나쁜 년이라고 하지마 나쁜 건 너를 그려야 XO XO
Wow! A big hand to the thanks our lovely student for their impressive opening performance. Thank you. Okay.
Excellencies, ladies and gentlemen, now it's our great pleasure to welcome our distinguished guests. I'd like to invite on stage Professor Kristin Sorensen, President of International Heritage Association. Welcome, Professor Kristin Sorensen. I'd like to invite on stage Professor Diane Levin, Chair of Heritage Group in the International Alliance for Health Promotion and Education.
Welcome.
I'd like to invite on stage Professor Tuyển Văn Dương, Vice President of Asian Heritage Association. Welcome, Professor Tuyển Văn Dương. I'd like to invite on stage Professor Padmini Murthy from the New York Medical College. Welcome. I'd like to invite on stage Dr. Huang Shiwei, President of Sichuan Memorial Hospital, Taiwan.
Welcome.
I'd like to invite on stage Professor Peter Chang, President of Asian Heritage Association.
Now, it's my honor to introduce the host of the AALA conference, Dr. Zheng Siwei, to give us the opening address. Huang Siwei. Dr. Huang Siwei.
So good morning, everyone. Our distinguished guests, and also let me say in Chinese, some of our distinguished guests from Taiwan. 敬爱的台中陈山院长，然后台中卫生局曾局长然后我们这个高副院长，然后我们彰化县父母官那个林副县长，然后我们主任秘书这个张主秘然后我们林院士，然后我们这个是吴兆军这个署长我们的这个最重要的长官然后我们的周理事长，那我们工研院的林所长那我们还有非常多的在场的贵宾，我就不一一唱名。So let me go back to English. And so it's my great honor and pleasure to give a welcome speech to this 8th Asian Health Literacy Association meeting in Lugang Zhangbin Shouchuan Hospital. Our hospital, I can take out the mask because our government is now opening the borders and we have more relaxed quarantine policies. But our hospital, as you know, is located, we have 8 hospitals across Taiwan, around 3,500 beds in the Shouchuan Hospital system. And over next year will be the 50th anniversary of Shouchuan Hospital. And the hospital was founded by President Huang, which is also sitting in front of us here. And from the beginning, the hospital is based on health promotion and health literacy 50 years ago, because all the 8 hospitals are located very intentionally in the most remote areas. As you can see, the town of Lugang is maybe less than 20,000 people, and we are located about 5 kilometers away from the Lugang area along the coastline. It's about 1 kilometer from the sea coastline, so it's very underserved area. So this has over the last 16 years, this hospital has really helped improve the health wellness of the residents along the coastal areas of Taiwan. So and also, as you can see, this hospital, so the founder says, it's not really a hospital, it's called a hospital and hotel combined. The intention is to make the hospital a really a place where it's really attractive to regular people, to anybody who wants to come in and gain knowledge of health promotion. So that's really the idea based on the design of our hospital systems. So it's our great honor to help this 8th conference of HLA and to really have this wonderful lectures and debates. I'm sure will be happening in the next 2 days, and to gain the knowledge of all of us who is really striving towards greater achievements in this area. And it's especially important in this time of pandemic and really important in the Asian countries. So there's so many important guests and delegates. I'm sure this will be a really successful event in the future, and I hope you can enjoy your stay in Taiwan, because we have not seen many international people for over 3 years. And I'm sure you will enjoy the town of Lugang, and hope you the great success to this meeting. Thank you.
Thank you, Dr. Huang Siwei, for your grace for the 8th ADLA conference in Changhua. Now, please allow me to invite Professor Peter Chang, the President of the Association, the winner of 2017 International, a physician and lifelong champion for health services and health literacy, to give us an opening address. Welcome, Professor Peter Chang.
Can I have my slide? We cannot. Can I have my slide? Good morning, ladies and gentlemen. Sorry, as a professor, I always want to use the PPT, but it is not under control at this moment. Good morning, Xin Zhao, Solomon Pagi, and bonjour, and many of you that come in from Taiwan, Gaoza. Good morning. It's a great pleasure to have the 8th ADLA conference as the president of the ADLA Association in Changhua, Lugang. ADLA conference, ADLA Association actually start from 2013, so that will be the 10th year. Okay, so I would in 2013, Shi Yaotang met me, and we start to talk about health literacy in Asia, in Taiwan, inspired by Christine Sorensen in Maastricht University and Europe. And later we established this association. I can't have, oh, sorry. And that was 2013 in Taipei Medical University. And with a lot of important Yan Yin, Shi Yaotang, and Zheng Qirui. And it was not association by the time, but next year in Wu Zhixiong, Shuanghe Hospital, we signed constitution, and we with many of the friends coming from different countries, and they established this association. And my job is to make it legal in Geneva. So So I'm not doing this very well. So my job is to bring the constitution to Switzerland, Geneva, and go through all the legal process. And we install this international organization in Switzerland since then, right? And then we have 2014 is the highest park. The first 3 years are in Taiwan, in Tainan, and Su Huizhen Xiaozhang in Chengkong University, and Qimei Hospital and Xinluo Hospital, they all joined this association conference. And by the time the mayor, Lai Ching-te, was come to adjust to us very much. And then we go to Vietnam in Haiphong 2016, and the deputy minister and the rector and the vice director, they all joined this very, very big conference. I think it's more than 300 people attend this conference in 2016. Then we moved to Malaysia, Kuala Lumpur. with Tin Tin Su. You can tell that many of the, including Terence Tsai over here, already joined the ACLA conference. 2018, we come to Taichung. Zheng Zizhan was the new beginner director of the health, and Wang Yingwei was by the time past the executive DG, and Terence Tsai, Tsai Mingze, was able to make this very successful. You can tell we do not have enough seats for all the important guests. And then 2019, we moved to Ho Chi Minh City again. So Vietnam hold twice, very, very important. I think Vietnam is going to be the champion for health literacy. And then we have Kobe, and but 2020 and 2021 with Christine and Dan, I mean, we want to hold the first Global Health Literacy Summit, 世界第一次的健康势能高峰会议, and it was only possible by virtual. And Chen Jianen was receiving all the distinct guests in Presidential Hall, and Lai Qingde was giving online address in 2021. So finally, the ACE conference is built on from number 1 and number 7 all the way from all different countries. And fortunately, we have a Zhang Bin Shouchuan Hospital helping us. And we are very happy to have Vice President Lai Qingde give us the congratulatory message. He is now in Palau. So unfortunately, otherwise he would join us. And we are also happy to have Speaker of the Parliament, Yeo Shih-kun Yenzang, give us this very important. He said that brainstorm, together we are wiser, health literacy, good for all. I think that's the good message from the. And I would like to thank all the important friend and colleague come to this, including our scientific committee. Many of you are here online, and also Don Mandun as the chair of the scientific committee. We have very, very heavy program committee and awards committee, and also local organizer committees. And this is my last slide. I'm not supposed to speak too much, but I want to put it in English and Mandarin. And maybe I start with Chinese. And I hope this will be a most important message that maybe our Wu Zhaojin Shuchang is going to use that. I hope you will quote that. 健康势能好，为什么呢？民众生病少，他健康势能好，他就不太容易生病，他会做预防的，生病恢复很快就好起来哦，所以医院呢很快就可以把这病人治疗好。第三个，医疗成效高，用的钱比较少，因为病人知道怎么接受医疗，那专业成就高，我们医院、我们医师、我们医疗人员觉得很有成就感。所以健康势能为什么对台湾、对全世界很重要？因为它有4个好处。So higher health literacy, the public less likely get sick. They have taken preventive measures. The patient recover better. If they get sick, they have a better health literacy. They recover, become healthy again, and improve healthcare efficiency, reduce medical waste, and successful healthcare service professionally. We as a healthcare profession, we would achieve much better in our career. So this is my the message that thank you again for being with us. And it's almost impossible to have this ACE conference after almost 3 years. So I like to present my appreciation to 2 distinct gentlemen. First one is, can I have next one? Yeah. First one is my mentor, but actually my mom was born in the same town with Huang Minghe Zongcai. So if I could invite Huang Minghe Zongcai to give ACLA Contribution Award. 奖杯是总裁请。
I'd like to invite on stage Dr. Huang Minhe. Dr. Minhe Huang is the founder and president of Changbin Sichuan Memorial Hospital, and thank you for your supporters. I'd like to invite Professor Christine Sorensen, president of International Health Research Association, to present the award to Dr. Huang Minhe.
Dr. Huang Minhe is 张斌秀传的创立者，也是秀传医院的开创者。大家掌声鼓励 again。
And next one, I would like to appreciate the make a very important decision to hold this ACLA conference, because ACLA couldn't do any conference for 2 years, and whoever to make this important decision, very difficult decision to make it work in 张斌秀传医院 is Dr. 黄世伟院长。我们大家感谢，掌声欢迎黄世伟院长。
I'd like to invite Professor Dan Levin, Chair of Health Literacy Group in the International Alliance for Health Promotion and Education, to present the award to Dr. Huang Siwei.
Dr. 黄世伟是我们张斌医院的院长，期待他在院内能够更强大，让我们的院长更顺利。掌声鼓励鼓励。王俊伟院长是我们张斌张秀竹山的总院长。It's a time to have a group photo. Please, all the welcome participants, please stand up. We are going to take a photo. Yes.
两位在中间。
请看我们的左手边。We'd like to invite the President Huang Minhe to ring the bell. So be seated.
我们能不能请我们的卫环部的长官来敲这个门？因为全民健康你最轻松，就不要那么忙了。
我们欢迎吴昭君署长。我们欢迎我们的长官，请大家鼓励鼓励。
People's health. And if they represent
希望我们敲锣，希望我们的健康越来越好。那希望这一次的 ASLR Asia 健康智能国际会议能圆满成功。Thank you. 好，请各位长官就座，谢谢。Thank you. Yes.
Excellencies, ladies and gentlemen, we are urged by international participation from more than 50 countries through international and Asian Health Literacy Associations members and International Alliance for Health Promotion and Education. Also, many other members and networks. Allow me to extend our warmest greetings to our VIPs and delegates.
感谢所有的贵宾长期的支持，也莅临到这里指导。待会唱名的时候，我们因为时间的关系，可能会变得快。但是所有的长官，麻烦请站起来，跟所有的人打个小招呼。厚生基金张火生董事长，
欢迎。
卫福部张优敏主秘，
欢迎。
台中荣总陈世安院长，
欢迎。
中国医大林昭根院士，
欢迎，
弘光科技大学黄月贵校长，
欢迎，
台北荣总高寿岩首席副院长，
欢迎，
台中市卫生局长曾之展，
欢迎，
陈秋明专员，彰化卫生局尚小青副局长，
欢迎，
外交部翁英敏处长，
欢迎，
经济部吴文珍主任，
欢迎，
秀传医疗体系黄进远执行长，
欢迎，
秀传医疗体系陈秀珠营运长，
欢迎，
彰滨秀传医院严宏章院长，
欢迎，
彰滨秀传医院李奇学副院长，
欢迎，
工研院生医研究所林启万所长，
欢迎，
台湾女医生协会黄荣如秘书长，
欢迎，
全球台湾医卫总会邱丽莲分会长，
欢迎，
屏东荣总陈宏哲主任，
欢迎，
中兴大学林俊良副校长，
欢迎，
中山医学大学蔡明哲总院长，
欢迎，
中正大学郝凤明副校长，
欢迎，
王祥成研发长，
欢迎，
刘怡婷经理，
欢迎，
南投医院洪宏昌院长，
欢迎，
中台科大郑凯元副校长，
欢迎，
元培科大黄小令国际长，
欢迎，
中台科大黄怡静主任，
欢迎，
东海大学翁昭仁教授，
欢迎，
亚洲教育科学文化蔡定彦理事长，
欢迎，
理克翁树慧董事长，
欢迎，
维康赖条源董事长，
欢迎，
光丽李爱珍董事长，
欢迎，
建仲张义文总经理，
欢迎，
中英医疗集团刘静怡董事长，
欢迎，
嘉兴企业卢玉娟总经理，
欢迎，
永跃生技徐唐峰董事长，
欢迎，
春兴生技孙瑜婷董事长，
欢迎，
台北医学赖彦成秘书长，
欢迎，
SAG 集团黄雅丽董事长，
欢迎，
恩凯生物科技施美琪经理，
欢迎，
丰明兴业蔡文瑞董事长，
欢迎，
瑞基海洋生物科技魏思礼首席，
欢迎，
魏景祥副协理，
欢迎，
钟炳汉经理，还有我们大业大学叶世仁副校长。
欢迎。From international participation, I'd like to welcome the delegates from Thailand.
Welcome,
I'd like to welcome delegates from Indonesia.
welcome,
I'd like to welcome delegates from Vietnam.
welcome,
And I'd like to welcome delegates from Palau.
welcome.
Thank you for your participation in this opening ceremony. We also appreciate the support of sponsors, and as without them, we cannot have the conference today. Thank you so much.
欢迎。
Now I'd like to invite Professor Christine Sorensen, the President of International Heritage Association, to deliver her address. Welcome.
So good morning, good afternoon and good evening to our international guests that are joining online. distinguished guests, dear colleagues and friends, old and new ones. On behalf of the International Health Literacy Association, it's my pleasure to extend our greetings and gratitude to our hosts here in Taiwan and our colleagues in the Asian Health Literacy Association and beyond. The world has changed since many of us met 3 years ago in Vietnam during the last Asian Health Literacy Conference. We are much wiser and stronger. We are wiser because we have endured the pandemic, and everyone now knows why health literacy is so important. Important for people to find, understand, appraise, and apply information to deal with old, new, and complex diseases. And important for healthcare and public health systems to manage outbreaks alongside other troublesome conditions. And we are stronger because we have proven the power of global collaboration that manifested itself in persistent care for each other and the implications for societies concerning policy, research, and practice. And the challenges are still lining up. Climate change calls for planetary health literacy. Geopolitical unrest calls for cultural sensitivity. Uneven distributions of resources calls for fairness, inclusivity, and protection. And while we may not always have the solutions right at hand, because we are now stronger and wiser, we have shown that we can raise to the occasion. And let us continue to work in this spirit. So let me take this opportunity to thank all of you for being health literacy champions, for paving the way for people to enjoy care, health, and well-being during this difficult chapter in history, and for your courage and relentless efforts to create health literacy for all. For me, you are the change makers and our true hope for a better future. So thank you for supporting the Health Literacy for All cause. Thank you.
Thank
Thank you
you.
so much. Now I would like to invite Professor Dan Levin, Chair of Health Literacy Group in the International Alliance for Health Promotion and Education, to deliver the address.
Thank you can you hear me? Thank you very much. Good morning, good evening, good afternoon from all of our global community. I want to thank you all for hosting us so beautifully, and all those who've supported this year and throughout all the years. It's just a pleasure to be here. It's almost against all odds that we're together face to face, but with all the efforts that have been made by the organizers and by the supporters and the hosts, we're together again. And it's a real thrill to be seeing people together, even through our masks. I'd like to bring greetings from the International Union of Health Education and Promotion, who have been partners of the AHLA organization since the first conference. We have a global working group on health literacy, and many of the active members are also active in AHLA and in ILA. And we're together, a health literacy community. It's a global community who's worked together to promote policy, research, and practice and health literacy. We met the challenge during Corona, we persevered, and here we are again together. So thank you so much. We really appreciate all of you who have supported this year and all of the years, and look forward to a wonderful 2 days together and beyond. So thank you again very much.
Thank you, Professor, for always being with us 2 years by years.
还有2位刚来的长官，我要在这里介绍一下。苏俊国驻台北印尼经济贸易处代表处 ，Mr. Winken Aga Prina, Director of the Industry Department IETO, and Mr. Yoser Mar, Assistant to Director Industry Department of IETO. 2位来出席我们的开幕式 ，Welcome them. Thank you.
Moving along, I'd like to introduce our honest guest, Delegate Deputy Ministry of Health and Welfare, Taiwan.
吴昭君署长 ，and 苏崇良市长。
王总裁，还有我们陈院长，我们主秘，还有我们在座的所有的宾，特别我们彼得张 张理事长、是远方所有的参与今天健康势能国际健康势能的 conference 的 Welcome to Taiwan and it's my pleasure, it's my honor. 因为部长今天有要事没有办法到现场跟大家祝贺，那么希望我在这里来祝贺我们今天的大会能够圆满成功。那么健康势能刚刚张理事长讲得很清楚哈，健康势能的重要性不只是我们医疗团体必须要了解健康的势能，那么我们必须要在全体的国民能够让他更了解健康的势能。国民健康署其实在卫福部里面整个执政的一个团队，那么将高龄友善城市、城市的治理，还有健康促进，还有健康势能列到我们国家的一个施政的政策里面。所以我们国民健康署负责制作了 QPL， 能够让民众那么大提出在医疗端以后呢，能够有一个更好的沟通连结，让我们Doctor 跟 patient 之间能有一个很好的沟通的平台，也能够让病人更能够精准的了解他问题之所在，也能够让医师能够更准确的掌握到病人的问题而加以解决。我想国民健康署未来还是长期在致力于推动我们健康势能够提升，所以我们部里面来讲，目前正在整合过去我们预防保健相关的一些资源，能够透过能够进一步的精准跟精进我们整个预防保健，希望能够提供国人未来更好的一个连结。那么今天的国际会议呢，就是真正的大家共同对于健康势能这一件事情的重视能够透过国际的交流，大家的分享，能够让我们共同学习，让整个国家的治理、民众的健康能够大进一步。那今天非常高兴能够在这里欢迎大家到台湾来。在这2年的疫情过去以后，那我们怎么样让所有的防疫的精准的资讯正确的防疫能够提供给国人，让共同合作，让我们台湾的防疫能做得更好，这样仰赖我们台湾国人民主的饲养与健康势能的提升。最后进入今天的大会都能够圆满成功，所有的贵宾都能够身体健康，万事如意。谢谢大家。
Now, next, welcome to our honored guest, Deputy Mayor, Changhua County, Professor Lin Tianfu. Welcome to give an address.
Hào, 谢谢。黄总裁，还有我们卫福部张主秘，我们吴署长，还有我们袁院长、黄院长还有我们台中荣总陈院长台北荣总我们高副院长，还有台中卫生局曾局长，还有好多的贵宾来自国际的友人大家早安，大家好 ，Good morning。谢谢。我今天非常荣幸有机会代表我们彰化县大家长王县长来参加我们亚洲势能健康势能学会第8届的国际医疗会议。我们彰滨秀传医院这个17年以来在我们台湾中部在我们彰化一直以来提供非常好的这个医疗服务，也是一直受到我们这个乡亲的欢迎。那今天呢，我们非常高兴由我们这个彰滨秀传纪念医院来主持这次的国际研讨会。我们彰化县政府我们全体的县民与有荣焉那我们黄总裁常在讲说，秀传医院不是只有一家医院，这边是一个医疗园区健康园区。一直以来，除了提供很好的这个医疗环境医疗设备，这个不断的这个增进我们所有中区民众的一些健康保护之外 也提供了很多的这个医疗培训的部分，特别我们黄总裁还在园区里面成立了亚洲的这个微创手术远距的这个训练中心啊，一直以来对我们医学的促进这个非常非常的巨大。那这一次的国际研讨会啊，是10月13号我们行政院放宽国门以来，我们在国内举行的第一次最大的这个实体的这个国际的会议。那今天呢，有来自100多个这个组织代表的参与，那所以特别代表这个县长欢迎来自国际的友人，所有的好朋友，我们也预祝我们今天的这个会议圆满成功也祝福我们与会的所有代表健康平安。谢谢大家，谢谢。
谢谢你。
谢谢我们的富田副县长。Ladies and gentlemen, every year all our conference would like to appreciate the contribution of scientists. Now it's a time for the ceremony of the 2022 Yufeng International Healthy Literacy Award.
I'd like to invite our state professor Peter Chang, President of Asian Heritage Association, to brief us about the award.
The award is composed of a committee member, including Professor Padmini. I think she's coming any minute. She will come in, and from New York. And also we have Professor Christine Sorensen and Professor Carmen Toravin from University of Philippines in Manila, and also Professor Angela Liang in Hong Kong Polytechnic University, as well as Professor Don Mun Dun from Taipei Medical University. And we have 2 winners because Padmini is coming, so I have to take her position to announce what is the award about. Apparently the computer doesn't like me. Okay, the Yifeng Award is that Madame Yifeng Xu. She was born in Lugang in this town, 1927. And she completed her education in Zhanghua Nuzhong, Zhanghua Women's High School. And therefore she stayed 47 years as a senior accountant in Taiwan Bank until she retired. And later she changed herself, become an artist. And she is my mother, okay? And Yifeng Award, because she participated at her 88 and 89 years old. She participated twice in art conference. So therefore, since 2017, when she passed away, we established an award. And each year would award granted to those international outstanding scholars and educators in health literacy. So I would, after the committee, I would announce the winner. There are 2 winners for this year's award. If we can have a control from the back. Someone can pray. I mean, it's kind of nervous to know who is the winner. You can help. Yeah, go ahead to the next one. Yeah. Who is in the back of the operation? Okay. But I will announce the winner. First winner is from Vietnam, Dr. Ruan De Rong. Let's welcome Dr. Ruan De Rong.
Congratulations to Dr. Nguyễn Thế Dũng from Vietnam. Dr. Nguyễn Thế Dũng is
a medical doctor, also professor in the National University of Vietnam in Ho Chi Minh City, and he also advisor to the Pham Nhat Thanh Medical University, and he is former director of Department of Health in Ho Chi Minh City. You know, Ho Chi Minh City has almost the same population like Taiwan. And he is a vice president of the Health Economy Association in Vietnam. So congratulations, Professor Ran Terong.
I would like
And
to
we would like to invite
Professor Christian Sorensen, President of International Health Disease Association, to present the award to Dr. Nguyễn Thế Dũng from Vietnam. Once again, congratulations, Dr. Dũng. And I'd like to invite you to present a remark.
Good morning, colleagues and friends. Firstly, I would like to thank the organization, committee, and my close friend, Professor Peter Chan, Asian Health Literacy Association, for inviting me to the AATLA International Conference in Taiwan, a wonderful country. I'm Dr. Nguyễn Thế Dũng, Vice Chairman of Vietnam Health Economics Association, former Director of Ho Chi Minh City Health Department. Now I'm teaching at School of Medicine of Vietnam, National University, Ho Chi Minh City, and Phan Ngọc Thạch University of Medicine in Ho Chi Minh City. We are very happy to be here by Health Phone and On for Health was key in health literacy. When I was a primary school, I learned prevention, hygiene lesson. So health literacy. I try to do it for our healthcare system. How does Vietnam improve health literacy? Vietnam is a developing country, as you know, with a population of around 100 million people. So it's a challenge to have good health for all. So literacy is the first step to getting knowledge. Knowledge is the first step to getting everything. So health literacy is the key, the first step to getting health. Many thanks for this research award. Many thanks, Madame Yong Phu Hsu, for her heart, for kind heart for our healthcare system. Yeah. It's my honor and happiness. I work for our health system with the only goal, sharing with everybody, everyone for the better life. That's my goal for healthcare system. Health literacy is one of the key objectives of our healthcare system. So I am going to try to effort for it. Based on it, we have friendship, we have a better life, peace and happiness. Thank you.
Thank you.
Now we have the second winner who, without too much introduction, you probably know very much, is the Dr. 梅香鹤何美香教授。何美香教授是今年的 这个易碰奖。那易碰奖基本上国际的奖，还有这个亚洲之外以及台湾的是属于这个另外一个奖。那何美香教授 ，You are very welcome, and we have Tom Dun going to present the award.
Congratulations, Dr. He Meixiang. Please give a big hand. Once again, a big congratulations to our Okay. Thank you. Please give a big hand to Dr. He Meixiang. And now we present like Dr. He Meixiang did a big.
Good morning. Good afternoon, ladies and gentlemen. It's my great honor, and I'm very grateful to be here. Of course, for many reasons. First of all, the pandemic is over. At least the worst part of it, you must agree. And congratulations, we all survived. And I'm very delightful to receive this award and recognition. Of course, comes with this award, I must speak a few words in front of you all honored guests here. We must all agree that research is an integral part of pandemic response and control. Because the scientists and medical community broadly are naive to the nature of the disease and the pathogen, just as the human being as a whole in the world are immunologically naive to the pathogen. So the scientists have hold up the sentiment and work hard around the globe to collect information. Unfortunately, many of that have been based on many people who falling sick and sometimes lost life. But they collect the information and quickly publish it. So with this information quickly coming through, I, as a scientist, began to collect information, much because it was my intellectual curiosity. Well, first I must say that I have retired. For that reason, I have no access to any research facility. So I read the literature. Then I quickly realized that there's a big gap and there's a great need for the public to have this information. And at this moment, I must express my thanks to the media friends who continuously pose questions to me, pose inquiries to me that guided my direction of collecting information and deliver the information. And also their ways of creating the channel for me to communicate with the public. So it has been well said that health literacy is social vaccine. I must share with you a piece of little joy I have personally. In the past 2-3 years, many times I walk in the streets, even with my mask on, and I receive thankful notes and messages from just, strangers. They would thank me for the things I do, for what I said, the message I deliver timely to them. And they said it was helpful to them. So I'm very grateful that I had this opportunity and very grateful for the recognition. And I'm very delighted to be a part of the delivery system of social vaccine. So thank you very much. And wish you all happy, peace, and health. Thank you.
Thank you. Since you already received an award, but we have a chairman of the award committee just arrived. In order to make this a complete one, May I invite all the award committee and the award winners to take a photo together. And you are in the center.
Welcome and take a photo. Thank you for all the group with all the ladies and come to take a photo together. Thank you for your participation again in this kind of grand opening. All right, thank you. And be seated. All right.
And so these ladies and gentlemen, now it's time to take a group photo in commemoration in today's conference. So we will take several photos in our opening ceremony today. And the first picture, I'd like to invite all of you, please sit where you are and we'll take the first photo. The cameraman will take the photo from the stage and please.
All right, I would like to invite all of you guys and come to the center of the row. We are going to take a grand opening of photo and make sure you can see the cameraman in here.
Yes.
So please, everybody stand up, please. Everybody stand up, please. Yes. And please take off your mask. And we are going to take a photo.
We will follow the guy of the middle here. So please, some guys over there, we will move to the center of the hall.
To the center of the row. And close to each other. Thank you.
Please, some guys are over there. We can move close to each other.
Yeah, welcome to see in front. Okay, can you turn around a little bit? Yes.
请大家向中间靠拢哈，请大
Please
家
close together.
后面尽量向
This
中
is very
间靠拢。
important. 长官，我们贵宾，我们等一下照3张相。Okay, we are going to take a 3 photo. The first photo, please 用你的最灿烂的 smile, the greatest smile in the photo.
So are you ready? Please take your mask, please. Take off the mask, please. And I will count from 3 to 1.
No, not yet.
Excuse me.
Please closer, please. Ladies and gentlemen, please closer. Closer. Yes. Yes. Okay, please closer. The camera will put it together.
Okay, are you ready? Let's smile, and I will count from 3 to 1. 3, 2, 1, action! Another photos, we will give the
Give a
heart
big
symbol,
heart.
okay?
Everybody can pick a heart. Lai Xin, lovely heart.
Are you ready? 3, 2, 1, let's smile. Okay.
Okay, last.
Another
one, please thumbs up. Welcome to the ACE International Conference. 3, 2, 1.
Okay. And the last one, we'll make a last one photo. So we'll have a freestyle.
Freestyle.
Yes. 3, 2, 1. Okay.
Thank you. All right. Thank you. Wish our ACE International Conference will be successful. 谢谢各位贵宾的到来。待会我们后面in the lobby we have 有一些咖啡跟点心。那等一下我们还有各场的会议，请大家注意时间，然后就坐。我们等一下会议开始。
On behalf of the host and committee, we would like to express once again our deepest appreciation to all for your participation. Once again, thank you. And we have coffee and cookie outside. You could enjoy it, and we have a short break, please.
Do we take photos over here in the Zoom? If not, I can print screen over here. Would everybody like to turn on the
So, ladies and
camera?
gentlemen, don't leave the stage so early. We have very important opening remark from Professor Diane Levine. So you can open the No, the remark before break. The remark before break. Okay. Okay. So we were not so clear. All right. There's no break. Hello. We haven't get the break yet. Please be seated. Please be seated. We have a next very important opening remark. So don't explain.